Now, I already alluded to the fact that shortness of breath can be caused by a variety of problems in other organs. And when we list them here in simple order of various tests that we can look at to identify where the problem is, we have to think of several things. So first of all, we look with a blood test for anemia. Anemia can be caused by chronic kidney disease, by bleeding, by blood loss through the GI tract, iron deficiency. A whole host of reasons can lead to anemia, and anemia is very common in patients with vasculitis. And when you're anemic, you're short of breath when you move. So we need to see, do you have anemia, yes or no? And if it is yes, then we need to find out what the actual cause of the anemia is so we can correct it. If you have heart failure, the symptom is shortness of breath. So we very often take a look at your heart with an echocardiogram to make sure that there is no heart failure. Or we do a blood test that is often abnormal in patients who have heart failure. That's called the NT-proBNP. It's just a blood test that looks for heart failure. Then, the airways, if they're narrowed, already mentioned that, we can lead to shortness of breath, and we use pulmonary function testing to find out whether there is airway narrowing. The pulmonary function test, as well as imaging studies, tell us whether there is something wrong with the lung tissue. If there is a problem with the pulmonary vessels, either through blood clots or through pulmonary hypertension, we can find that out again with a variety of tests, the first one being an echocardiogram. Sometimes, if you have nerve problems, the respiratory muscles can be weakened as a result of that. And again, we have some breathing tests that point in that direction, and the pulmonary function test will allow us to detect whether there are respiratory muscle problems. Now, kidney, I already mentioned that can lead to anemia, but kidney function impairment can also lead to fluid overload, which can then back up in the lungs and impair the gas exchange and make you short of breath. And finally, and last not least, after you've been very ill for a long period of time, you will have lost a lot of your normal muscle strength, and you will be very deconditioned after a chronic illness. And then every effort is much harder until you have been able to slowly build back the muscle mass and the endurance and the conditioning. So recovering from a chronic illness is often an uphill battle. And part of this battling and regaining the conditioning requires an exercise program. And as part of that exercise, then you will initially feel short of breath, but ultimately you will be able to do more with less shortness of breath as you get better and reconditioned. So there's a lot of issues that can make you short of breath, and they need to be addressed in a systematic fashion.